Well, it's common to have a bad cough after you get an upper respiratory infection, which is usually viral, but these can turn into pneumonia, and that's probably what you're concerned about. So here are some signs that that could be happening. If you have a fever of at least 101, that may be a sign of trouble, or being really short of breath, especially if you're short of breath at rest or just walking across the room. If you're wheezing, you might benefit from going in and getting an inhaler. And certainly if you're coughing up blood, or if you have a lot of pain with coughing, that can be from just muscle strain, but it can also be from having inflammation of the lining of your lung, and sometimes that's a sign of a serious infection. So if you have any of these things or several of them, consider going to see your primary care provider or going to an emergency room.